Now back to our earlier story, the Gauteng MEC for Health and Wellness, Nomantu Nkomo-Ralehoko, is today officially opening the expanded Neonatal Intensive Care Unit at Hani Baragwanath Academic Hospital and welcoming babies born on New Year's Day in Soweto. We understand she is briefing the media there live. Let's take you there.
In Tembisa, of making sure that each child that lives here is registered. Newborn, they will be getting their death certificates. We are working with the Department of Home Affairs. We have an office here at Hani Baragwanath Hospital. So this is crucial to ensure that they can access all the essential services, including healthcare and education and the social support. That is always difficult sometimes to our parents that they do. And I want to urge all the parents that are here to prioritize immunization of their babies, vaccines that are safe because they are safe and they are important in protecting our children. That's what we have been doing in our own educational awareness programs, because when they are preventing diseases, they are promoting healthy environment. When you ensure that your child is vaccinated, you are building a strong bond and a foundation of a healthy and prosperous life. Today, a newly renovated ward, and you can see that it's very busy. We have a new that we will take you to. And this what symbolizes again our commitment to improve healthcare infrastructure while prioritizing the comfort and safety of patients. We don't want, especially on the neonatal wards, to have old wards now. All of them in all the hospitals, we're revamping them because of the importance of this new life that we are bringing. Hence, it's our priority to ensure that this is done with or with man. I always tell the DDG, he knows, he can tell you, all of you, some of the upgrades that he has done. He had to go to other units and to make sure that these wards are upgraded because of the environment that we have in terms of our infrastructure in the hospitals. And I always say that infrastructure is critical as it is clinical governance. It's critical in our hospitals because you can't separate them. They go together, because if your infrastructure is not to the level that is expected, definitely people will be infected with the diseases that you are trying to treat them. So hence I said now every December and every January, I will not just go and kiss babies, as I always say. I must take them to a better place where they will be comfortable with their parents and the mothers. And we've done again, you've seen the beautiful ward that we did there. Kopanong and other district hospitals and regional hospitals have those neonatal wards again that are being revamped as we speak. So the renovations include the private cubicle for parents, patients, enhancing their dignity and safety, and innovation of elbow-operated taps that you will need in the hospital. Remember, we don't touch, we always use even our elbows when we open them. These improvements are very important as we work tirelessly to meet the growing demand of healthcare services and ensuring our patients receives the highest standards of care. So this hospital is not just a healthcare facility, it is a lifeline of our community and caters for a diverse range of patients from Ekurhuleni, Johannesburg, Tshwane, Sidibeng and West Rand. We don't turn anybody away here. That's why we have opened now the APT that you know it has not been operating, because we are taking people to that side. Forensic unit is opening on that side. We have been working with the police because some of the cases, including incidents that happened yesterday, some of the people were taken to the APT so that they can be tested, drink water that 5 hours, we monitor them, then after that we can release you home or the police can do their work. But again, which I'm so excited about it, colleagues, media, especially yourselves, because it's a question that will ask me. We have 13 babies that we have received at, on the New Year's day, on this day, which is critical. At 12 noon, we had a baby that was born immediately, 12 midnight, that baby was born. But what I don't like, because I'm a woman, it's 9 boys and 5 girls. I'm not happy about that, because I thought at least I'll have more girls and then have few of the boys, because I'm biased towards it. But again, what you want to know, I know. How many children are South Africans? we have all of them except one that is a Mozambican. The rest out of that 13, which is 12, are South African children. Can you see the improvement again in terms of our stats because of e-health that we've introduced? Now we're no longer thumb-sucking the numbers. We know this child is a South African because we are aware of the systems that we've installed, which is innovations that we've seen. Heidi, because we started ENCA team, started on that side. We have a beautiful center that we've opened that even we see people that are getting into these wards now. Foreigners or South Africans, we know them because we have a system that we have installed in all the 37 hospitals. We know who is in the hospital. We have a system again that has started here at Bara of making sure that our files don't disappear. Not a single file here is going to be disappearing because we will be having that e-filing that have started here at Bara. Now we're at Tele, at Smukeng Hospital or our Hospital, but we're spreading it to other hospitals with a team that is digitizing our systems. There's a huge improvement. All the things that Premier said I must do in the province, we've done it, colleagues. So to our health workers, which I will never be who I am without you. For the past 2 years, this is the 3rd year now that I'm in the Department of Health. You have been a pillar of strength to me personally, first educating about the systems in the health sector. A health specialist, but now there's not a single doctor or a professional that can surpass me in understanding the Department of Health. I'm challenging all of them. They know themselves in the whole province. I know each and every unit, what they are doing, what is it that I must do in terms of assistance. But again, the innovation that we've done to all these wards that I'm talking about, to all these hospitals, all have all the best machines that we can find in the whole world, in this hospital, starting here at the MEC Hospital, regional and district hospitals. So I'm proud to you, health team, and I want to encourage you to continue serving with passion, serving with empathy, and smile throughout the festive season and beyond. So your dedication and kindness make a world of difference for every patient. The family that walks doors on daily basis, I want to say to them, every patient and the family and yourselves, remember that your work is not just about healing the body, but it's about nature and the spirit. Hence, I have a team that I work within the province of religious leaders. Mama Khololo is here. She's the reverend that not only her, even in other hospitals, we have reverends that we have attached to hospitals that when we go, we work with them. We have the colleagues from the TAC. Mr. Mbasa is here with us. I work very closely with them anytime and monitor our wards. They send me messages. They don't just do what other colleagues or politicians do, bounce or hide behind cameras and sneak and take photos. They advise me. Thanks for being this healer to me, especially in specific critical areas like your HIV and AIDS. We are improving because of the work that you are doing. We're targeting 95 now because of the work that we're doing. Our relationship is more stronger. To the unions, thank you so much for being this number one criticism, number one critiques to me, but number one fans again, because you have criticized me when I arrived here. You questioned me, my status, that I am not a doctor, but I know all of you now, you are happy that Department of Health deployed a manager, and I'm doing exactly what I must be doing of managing my team that is here and support them, the counseling that we're giving to EMS, to forensic teams, to nurses. You work without capacity, but I'm happy colleagues from media. We are employing now, this January, we will not have any unit that will complain about the capacity. All of them, they're in the system now. We're finalizing the processes. So thank you so much, everyone that has made this event. I want to thank my fishes for swimming. You can swim better than this. Swim more, colleagues, because I'm with you. I'm fully behind you every way. And thank you, media, for always being here with me in particular, because you follow me. You are my number one critics again, but again, you are my number one fans, because all the issues that you have raised when I arrived here on the 22nd of October 2002, it was not easy even to answer those questions, but you made me strong. You made me understand exactly what's happening in every hospital. All of you individually, whatever you are saying, you must share it. Thank you.
All right, you were listening to Gauteng MEC for Health there, Nomantu Nkomo-Ralehoko, on a mission, of course, to enhance the dignity of patients in those wards. They are expanding the Neonatal Intensive Care Unit at the Hani Baragwanath Hospital. And she also details, I guess, good news. 13 babies received at midnight. 9 of those, 4 girls, but MEC not happy with that gender parity issue there. But of course, passionate plea from her. She's saying that health workers should actually keep embracing every patient at the hospital, and of course, asking every patient to be treated equally.